Good morning, everyone. Welcome to another AMA with Dr. Behnam. I'm Dr. Behnam. I'm a board certified dermatologist and one of the co-founders of Happy Head. Welcome. Our topic today.
Shedding, but we will be discussing kind of general questions.
Yes. So today we're going to be talking about the shedding that starts initially with the use of the topical Happy Head. So the shedding typically comes from the fact that our product has three ingredients in it. It has minoxidil, finasteride, as well as some hydrocortisone. So it's the minoxidil that causes the original shedding that could happen. Now, it doesn't happen everyone. It happens in about 5% of patients. And if you do get this shedding, it's not a big deal. Typically, patients that have an initial shedding initially end up with better results later on. So I wouldn't worry about it too much. Now, if the shedding extends beyond like the third month, then I would probably just stop using the product. All right, guys, here we go. So, can a non-U.S. resident sign up for Happy as long as the shipping address is in the U.S.? Yes, I believe so. Yes, it has nothing to do with being U.S. resident or not. It has to do with shipping it to one of the states in the United States. So, as long as you have a U.S. address, you can order the product. A friend of mine used another brand. I won't mention the name out of respect. Thank you. That has 15% minoxidil solution with azelaic acid. I told him that the company is not reputable because 15% is not stable. Am I correct? Yes, you are. So we actually have done a lot of our own studies. Minoxidil beyond 8% in a solution precipitates out. So you're going to get like a lot of crystals at the bottom. So you're really technically not getting 15%. So the highest that you could do in a solution is actually 8%. There are some creams that you could do that are 10 and 12%, but also remember it's going to be very irritating as well. Also, the other company has azelaic acid, as you mentioned. We took our azelaic acid out because of the irritation. On a separate note, I'm starting your program with a 0.1% finasteride and 8% minoxidil. Should I be using a separate shower for my wife to prevent exposure when I wash it off? Well, as long as she's not pregnant, it's not, or breastfeeding, I'm not worried about it. But if she is breastfeeding or pregnant, then you should probably use a separate shower. That's a very good question. I've been using the product for 6 months with no results and switched to dutasteride for 3 months ago, still with no results. Can you help? Yes. Well, look, some patients may not see any improvements with anything, but also, can you please send us your photos? I really would like to see your photos because look, if you have no hair on the scalp, that is not gonna grow. So please send me the photos and let me evaluate it myself. I would really appreciate it. We are here to help you, and it's possible that you might need to go on an oral and topical medication to kind of what we call sandwiching the hair loss with both oral and topical. So let me see the photos. I'll be more than happy to give you my medical opinion. Um, can you discuss the New York Times article about oral minoxidil? Do you offer oral minoxidil? What are the benefits and disadvantages of oral minoxidil? Yeah, so we have been using oral minoxidil in our office for the past 14 years. So, and we write it actually all the time, and Happy Head actually dispenses oral minoxidil all the time. Unfortunately, it's not on the website yet, but we have been doing it for a long time. So the New York article basically said that oral minoxidil can be used as a treatment for hair loss. Everyone already knows that because topical minoxidil is used for hair loss, and the way that they figured out topical minoxidil works for hair loss was because initially in the 1980s and 90s, oral minoxidil used to be used as a blood pressure medication, and they realized that people that were taking the blood pressure medication also had better hair growth. As a result, the company Pfizer basically took the oral medication and they made it into a topical application. So most people are familiar with the topical minoxidil, but not oral. But oral minoxidil is actually a very good medication. There are typically three oral medications, and I think we've actually talked about this before in our podcast. Three medications for hair loss orally: finasteride, minoxidil, and dutasteride. Oral finasteride and dutasteride are basically testosterone blockers, whereas oral minoxidil is a vasodilator. It's a blood pressure medication they use off-label for hair loss, and the way it works is that basically it dilates the blood vessels to your scalp and causes more basically hair growth by getting basically allowing more nutrients to get to it. Oral finasteride has a risk of sexual side effects. Oral minoxidil does not. So the most common side effect of oral minoxidil is very similar to topical minoxidil, which is headaches, heart palpitation, changes in blood pressure like dizziness or lightheadedness. Very rarely could cause ankle swelling. Typically, we start with a 2.5 milligram tablet. We tell the patient to take a quarter of tablet for the first 2 weeks, then a half a tablet for the second 2 weeks, and then move on to a full tablet. You could also get a blood pressure cuff, so you're measuring your blood pressure as you go on. No one uses the oral minoxidil that much anymore for blood pressure to reduce to reduce the blood pressure because it doesn't really work that great anymore. So there are better alternatives for blood pressure. But yes, oral minoxidil is a great drug. We sometimes use Happy Ed with oral minoxidil for patients, and sometimes that does tend to do better. So if you're on Happy Ed and you're not seeing like the results you want, you can always add oral minoxidil. Just send us an email at help@happyhead, and we'll be more than happy basically to get it for you. And honestly, it's relatively pretty cheap. It's not very expensive. I'm in LA this week. Is it possible to stop by your office to say hello? Yes, please come by. Yes, we're here every day. It might be a little bit busy, but yes, best time to come by is probably after 4:30. We'll be more than happy. Please come by and say hello. Yes, we're near Santa Monica, Barrington at Santa Monica Boulevard, and the Happy Ed office is actually above our medical office. So what about oral minoxidil? How would you switch from topical? So actually, we have noticed that patients that are on topical Happy Head and oral minoxidil do better. So if you're using Happy Head, you could actually, I would recommend you go on oral minoxidil and you will see better results. I have a question about the long-term use of Happy Head and the way to reduce the amount of chemicals I'm putting over the long term. Let's say I use Happy Head for 2 years and it helps me grow my hair back and I'm happy with it. After those 2 years, is there alternative to switch to that has less chemicals and is cheaper to maintain? Okay, that's a very good question. And he says maybe generic minoxidil. Yes. Once you get the results back, there are a lot of different ways of doing this. You instead of using it twice a day, you could go down to once a day, or you could go down to 3 times a week. So a lot of patients do that, and that will probably maintain the results. Sometimes when you go down at the frequency, the results might be sacrificed a little bit. So yes, going on oral minoxidil will basically help you maintain that. So there's a lot of different ways of doing it. When you reach that point, reach back to us, and basically we'll try to help you basically either taper off a little bit or add something else that might help maintain the results without using the products every day.
Okay, and then how would you know which one to take?
Oh, so how would we know which oral medication to take? Oral minoxidil, dutasteride, or finasteride? So this is the way I look at it. So finasteride and dutasteride are pretty much the same, very similar drugs. They're testosterone blockers. One of the side effects is sexual side effects orally. This is why Happy Ed was actually discovered, because Happy Ed is a topical finasteride, and in clinical studies has been shown to reduce the risk of sexual side effects. So, but then you have oral minoxidil, which really does not have the risk of sexual side effects. I don't think it works as good as finasteride, but if you're going to use it in conjunction with the Happy Ed, I think it would be as good. So one of the things to watch out for oral minoxidil is ankle swelling. That's one thing to watch out, and a change in blood pressure. So overall, I think minoxidil, a lot of people in my office actually choose oral minoxidil because it has no risk of sexual side effects. Actually, most people really do not have any side effects from the oral minoxidil. So that's how you choose it. So if you're afraid of the sexual side effects, you do minoxidil. If you're not afraid of sexual side effects, you do finasteride.
So if you're sensitive to either or, okay, and say you're sensitive to minoxidil, would taking oral dutasteride be an option?
Yes. So so remember, oral dutasteride and oral minoxidil are FDA-approved medications that are used off-label for hair loss. It doesn't mean anything. You guys should just know that. But yes. So, and if you don't want to go minoxidil, you can definitely do dutasteride. And the options are all available. It really depends which one you're more tolerant with respect to the side effects. But we carry all of those products in an oral version. Oral finasteride, dutasteride, and minoxidil. And again, as we've discussed this many, many times in the podcast, going on both oral medication and topical medication, patients typically do see better results. Now, I probably wouldn't start the Happy Head and oral minoxidil simultaneously. I would give it some lapse, like about a couple of weeks to a month, so your body kind of gets acclimated to it and used to it. Uh, why not put nearly everyone on a low dose of oral minoxidil, which is 1.25, since the side effects are so low? It seems to be effective in many cases. Well, that's a very good question. It really, like, a lot of patients just don't necessarily want to go on oral medication. I mean, and again, that is honestly why how happy it got started, because a lot of people are so opposed to oral medication. So, but look, if you want to go oral medication, we're more than happy to put you on. That's not a problem. Just reach out to Happy Ed, help a Happy Ed, and we're more than happy basically to get you on it. Again, 1.25 is a good dose. I figured out that probably for guys, the full tablet, 2.5 milligrams, is probably the best, and the side effects are still pretty minimal. Um, let's see. Is beard facial hair shedding normal? Not typically, but some patients could have it. Again, we know that, again, being on both the topical minoxidil as well as the oral minoxidil could help you with those, the facial hair as well. One of the side effects of being a high dose oral minoxidil that it could cause hair growth everywhere. So if you are Middle Eastern, like I'm Persian, so if you're Middle Eastern, and you go on a high dose, like 5 milligram, you could start to get hair growth basically on your ears and things like that. So that could happen. So that's why typically you like to have guys on a 1.25 milligram or 2.5 milligram of oral minoxidil.
Okay, that's interesting. So women with PCOS are more prone to growing hair
Yes.
as well. Would that work?
Yes, exactly. Yeah, so it depends. If you're fair, like white skin female, and you go on oral minoxidil, you're probably gonna have a little more of peach fuzz, but it's gonna be fair. It's not gonna be very noticeable. But if you're like Hispanic, Middle Eastern, Indian, darker, then you're gonna have more darker hair, which you may not appreciate. So remember, this is why the pill is not for everyone. You really need to have a doctor's consultation to really figure out which one is best for you. But if you're a guy, you go up to 1.5, 2.5 milligram tablets, you should be fine. Really, no problem. What is the best way to titrate up the oral minoxidil? Someone prescribed oral minoxidil. Do they need to start with a lower dose? And if yes, what is it? So, first of all, I always say get a blood pressure cuff and basically just measure your blood pressure as you go upwards. Thank you, Evelyn. So yes, the way I do it, so the tablets comes in 2.5 milligram tablets. So you want to cut into fourth, just get a pill cutter, cut into fourth. So do a fourth of a tablet for the first 2 weeks. Then you're gonna cut it into a half. You're gonna do a half a tablet for the second 2 weeks, and just measure your blood pressure as you go up. And then you're gonna go to a full tablet, basically moving forward. If you obviously have any side effects, let us know. Measure your blood pressure as you go up, to make sure there's no blood pressure changes. I typically would recommend taking the medication at night, not in the morning. So you don't have so because if you take it in the morning, then you're gonna see blood pressure changes in the morning. But if you take it at night, you probably won't. Again, results always takes about 4 to 6 months, like 3 to 6 months to see the results. Um, would someone take both or just one of the oral medications? So great question. Look, it really depends on your hair loss journey. Look, I have patients in my office that are on topical Happy Head, oral minoxidil, and oral finasteride. I swear, they are. Everyone's different, and you're seeing amazing results. It all depends on what you want to do, the degree of your hair loss, and how gun ho you are basically to get your hair back. If you're rapidly thinning and you're a young patient, and you really want to get the hair back, then yes, go on Happy Ed, which is a combination of topical minoxidil with finasteride, and then you can start with the oral minoxidil and also oral finasteride. Now, my only issue with that one is that don't do everything together. I think it's probably better to start with the Happy Ed first, so your body gets used to the minoxidil and finasteride, and then slowly add like finasteride and titrate that up, and slowly add minoxidil and titrate that up. So yeah, I see we're getting a lot of oral minoxidil questions here. Uh, Eric, should we give a hint of what new medication we're going to come out later on in the future with Happy yet? We are working on a surprise for everyone. It's going to be the only medication, oral medication in the market, coming soon. It's a combination pill of minoxidil with finasteride and biotin all in one pill. It should be hopefully released soon. Eric is working tirelessly on it. He's even sweating right now. I mean, he's typing away. It's in process. We're coming out with it soon. It's gonna be very exciting. So instead of, because a lot of people say, should I take this or that, combine it together? That's just with one pill, three medications all together. Would you recommend taking oral minoxidil and topical minoxidil? So would you recommend taking oral minoxidil along with the topical happy head, which includes minoxidil and dutasteride? Yes. Look, the more you do, when we sandwich things together, the better results we get. We have noticed that patients that do an oral medication and topical medication end up with better results. How many months typically it takes for you to see results with any of the oral medications? Minoxidil, dutasteride, finasteride, it's still 6 months. It's still 6 months, guys. With any hair loss product or any hair loss medication, it is still 6 months. My hair has been going gray white since my teens. Are there extra concerns about using happy in this case? I don't care about the hair color, only by keeping my hair and regrowing it out. So yeah, there's no special considerations. I mean, look, some people go gray. Look, guys, I've gone gray ever since I've had my kids. See, I'm proud of it. They give me a lot of stress, so I've earned these gray hairs. But yes, so yes, you could use happy head. It should not affect basically your gray hair at all. Again, so a couple of other things. Dermal roller, guys. Dermal roller is really, really important. If you apply the topical happy head and then basically dermal roll, you're gonna see basically the best results. And obviously, if you go on happy head, dermal roll, and take an oral medication like minoxidil or finasteride, then you're even gonna see better results. Remember, what's important in hair loss is that there are many different reasons why people lose their hair. So when you throw the kitchen sink at it, when you do everything much as you can, you're just going to naturally see better results. Again, remember, happy head has 3 medications in it. It's finasteride, minoxidil with retinoic acid. It's customizable, so we could switch it and change it basically as you wish. So if you start with the finasteride 0.1%, you could go up to the finasteride 0.25 as you wish. So you just have to let us know. Why is customization essential for hair growth? Well, that's a good question. Well, look, everyone's not the same. So everyone's going to react differently to a medication. So, for example, some people are very sensitive to topical minoxidil. So we give patients the capability of lowering the dosage of minoxidil from 8% to 6% to even none. Also, you could switch, basically change the finasteride construct as well, and also the retinoic acid and take the hydrocortisone out. So we allow for customization because we believe that not everyone is the same. We don't make a product that sits on our shelf for many, many months. Everything is customized for our patients. So that's why the customization is so important. Which type of dermal roll do you use? Any specific length? Yes, I like the 0.25. We do have it at Happy Head, so just go ahead and email us and we'll give you one. Is a 0.25 dermal roller at Happy Head. Why self-diagnosing your hair loss is a bad idea? Oh yes, self-diagnosis is a bad idea. The reason because there are many different types of hair losses. So for example, there's alopecia areata, which are autoimmune conditions. There are scarring type of hair losses, known as cicatricial alopecia, lichen planopilaris. So, and also sometimes patients are what we call telogen effluvium, which is a little bit different than male or female pattern hair loss. So it's always best to get the best treatment plan from a doctor. So it's important to see your doctor, and that's how we could customize your treatment plan. Remember, not everyone is the same. Can I take half a bottle on a carry-on and on flight? It's 60 ml.
Make it. It's not gonna spill.
No, but no, you know they have a limitation. No, you know they have a limitation. I think yes. Right, Eric? We could take Happy Head on a carry-on on an airplane, right?
Yeah.
Yeah, I think you should be able to. Yeah, we've had other people do it, and I haven't had any problems. Can you mix spironolactone and minoxidil? So that's a very good question. So for female, this is where you get into trouble. Because spironolactone is a blood pressure medication and minoxidil is a blood pressure medication. There's a doctor out of Canada basically who loves to combine the two together. So, and I do have patients on it as well. So if you're on a spironolactone 100 and you want to go on minoxidil, I might probably lower your dose of spironolactone to about 50 milligrams and then titrate the minoxidil up to 1.25. So that's how we do with female. But remember, everyone's different. I have a patient of mine who's on spironolactone 100 and she's on minoxidil 5 milligrams. There's two of the minoxidil tablets. So everyone is different. You have to start it up slowly and run it by your doctor. So, but if you combine the two, but you have to lower the dosage of them. What is the tretinoin and hydrocortisone? So the tretinoin has been shown in clinical studies to to increase the efficacy of the minoxidil on the scalp. That's why, isn't it? And the hydrocortisone, the 1% is used to reduce the irritation. So now some people don't like hydrocortisone in the product. You could ask us, and we'll be more than happy to take it out.
And if they're experiencing flaking and anything like that, what would be the solution? Would you go for a serum or would you go for a medicated shampoo?
Yeah. So if you are experiencing flaking, well, it depends. If you're just naturally flaking, that means you have dandruff. We do have an anti-dandruff formula, which is a prescription shampoo known as ketoconazole, along with a topical serum known as clobetasol. Reach out to us, and we'll be more than happy to basically put you on one of our plans. Then, however, if you're experiencing flaking and irritation and redness from the topical Happy Head, our recommendation would be one, wash it out after 1 hour. It should still work. Two, you could let us know and we could reduce some of the minoxidil from the product. Or three, we have an aqueous version where basically it has a lot less alcohol in it, and we'll be more than happy to ship it out to you. It's the same ingredients, but basically less alcohol. If the color Happy Head changes over time, is that okay? Yes, it's not a problem. The color could change. It's not a big deal. A lot has to do with the weather, things like that. So I'm not worried about it. So remember, it's gonna be a little bit yellow, but as the time goes by, it gets a little bit slightly darker yellow. I forgot to shake the bottle before it's used. Is that important? No, not really. But it's nice to kind of shake it to kind of you get all the minoxidil basically in the solution.
Okay. We still get the question of instructions of how to put it, like 0.5 in the front, 0.5
Sure.
in the back.
Yeah, so let me explain. So basically, every pump basically has 0.5. So if you're thinning in the front, let's say if you're thinning your widow's peak, do a 0.5 in one widow's peak and do another 0.5 another widow's peak. And then take your dermal roller 0.25 and gently roll back and forth for about like a minute on each side, and then you're done. Remember, basically spray alcohol in your dermal roller, so keep it clean. Change it like every 6 weeks. Now, if you're thinning the front and back, then basically you're gonna put a spray, basically one pump, which is about a half ml here and a half ml here, and a dermal roll afterwards. I remember, so it's 2 pumps at night and 2 pumps in the morning. Would you recommend a shampoo to use in conjunction with your treatment? Yes, I use basically our happiest shampoos and conditioner. I'll tell you why this is important. We made it. And you know what? We looked at every product out there and we wanted to see what are the best ingredients: biotin, collagen, keratin. We put it into one of our shampoos and conditioners, and it's really good. It has a little bit of a citrusy smell to it, which is great. And the conditioner is really good as well. You should be getting a sachet in your box. And also, again, we also have the Happy Head multivitamin. It's better than any vitamin out there, not because I made it, but also because of the fact that if you look at the ingredients, and honestly, compared to any other product out there, which I'm not going to name names, but we have more biotin and other stuff in it. So it's really good for your hair. If you want it, please let us know. I help my Happy Head, and we could probably also give you a discount on your first bottle as well.
Okay. And then since we're on supplements,
Yes.
what would be foods that we should avoid entirely? Like, I know coffee.
Yes. So coffee. No, you could drink coffee. That's no problem. Foods that you want to avoid is whey protein isolates. You want to avoid those are pre and post workout shakes. Also, you want to avoid energy drinks, soy milk, non-organic chicken, food high in MSG, anabolic steroids. Obviously, if you don't need to be on testosterone, I recommend not to do it. But if you're on TRT, which is testosterone therapy, and if you need it, then you need it. Can you talk more about your formula that doesn't have propylene glycol in it? How is it different from and what are the changes. So we do have one formula that basically what we call the aqueous formula. The ingredients are the same, so the efficacy is the same, but it doesn't have propylene glycol. It's about 80% botanical based. So it is less irritating, less redness. And please let us know. Just send us an email, and we'll be more than happy to change it for you. It's just less irritating. What is the shelf life of Happy End? It's typically 6 months, except for the Aquas formula, which is 1 month. Would it be easier for me to order larger amounts? I would like to know how many months can I order. I think you could do six. We have a 6 months package that you could order. That will be cheaper for you. So I'll have Evelyn basically post up the links for you, or just reach out to us.
It would just be requested on the customization request, or they just have to call.
Yeah, just give us a call. They just say avoid soy milk. Yes, soy will actually increase. So soy increases your basic estrogen level in your body. So one, it could give you man boobs. Two, it just alternates and changes the ratio between estrogen and testosterone. So we don't like that. So we typically say for guys, the less soy, the better it is. Look, if you have tofu once in a while, it's no big deal. It's just the fact with soy milk, you just drink so much soy. That could, alter some of the hormones in your body. Does finasteride raise progesterone levels? I don't believe so. I don't think it does. That's a good question, but I don't think it does. But I have to look into that.
Could you reduce, I think I already asked the question, but could you reduce hair loss by increasing testosterone? No, decreasing testosterone.
What was the question? Could you reduce? Right. So can you reduce hair loss by reducing testosterone? Yes. So good question. So typically, if you were to basically check everyone's testosterone levels, most patients basically are going to have testosterone within the normal limits. So it is not necessarily a testosterone level that's causing the hair loss. It is the sensitivity of your testosterone receptor to that testosterone that basically determines how sensitive you are. So some people have very low testosterone level, but they have a really high sensitive, what's called testosterone receptors, then they're going to have a lot of hair loss. Whereas some people could have a huge amount of testosterone levels in their body and a low sensitivity, then for them, the high testosterone level would not matter. So it really depends on your testosterone sensitivity. Now, if you're doing external testosterone, yeah, of course, that's going to cause more hair loss. But if you need it, you need it. Oat milk or coconut milk would be better? Yes. I like oat milk and I like coconut milk. Yes. Better than soy.
What about goat milk?
It should be fine.
Okay.
Yeah, goat milk is fine. Okay, guys. Well, thank you so much for all the questions. Thank you, Eric and Evelyn. And we're going to see you guys next week. Have a beautiful day. Bye, everyone.